Hello, I'm Katrina Rublilo Quinario. I'm here to present the 7 first aids and precautions for common kitchen accidents.
Activity 1. Cuts can range from minor to serious, and knowing how to handle them can make a big difference. First aid for cuts. First, stop the bleeding. Apply gentle pressure with a clean cloth or bandage. If bleeding doesn't stop after a few minutes, seek a medical help. Second, clean the cut. Rinse the wound under the clean run water. Use mild soap around the cut, but avoid getting soap directly in the wound. Pat the area dry with a clean towel. Third, apply an antibiotic ointment to prevent infection. Apply a thin layer of antibiotic ointment. Cover with a sturdy bandage. Precautions to prevent cuts. First, handle sharp objects carefully. Always cut away from your body and use appropriate tools for the job. Second, wear protective gear. Use gloves, safety goggles, or other protective gear when handling sharp objects or working in hazardous conditions. Third, keep sharps of reach of children. Store knives, scissors, and other sharp objects in a safe place away from the children. Activity 2. Burns can be serious, so knowing how to handle them is crucial. First aid for burns. First, cool the burn. Hold the burn area under cool, not cold running water for 10 to 15 minutes. Alternatively, apply a cool wet cloth to the burn. This helps reduce swelling and pain. 2. Protect the burn. Cover it with a sturdy non-stick bandage or clean cloth. Avoid cotton balls which can stick to the burn. Third, avoid breaking blisters. If blisters don't pop them, they protect the underlying skin from infections. Precautions to prevent burns. Kitchen safety. First, use oven mitts, keep not handles torn and warped, and stay alert while cooking. Second, electrical safety. Keep electrical appliances and cords away from the water. Third, sun protection. Wear sunscreen, hats, and protective gear. Clothing, avoid excessive sun exposure. Activity 3. Electric shocks can be dangerous, so knowing how to respond and prevent them is crucial. First aid for electric shock. Ensure safety. Before approaching to the person, make sure the power source is turned off. Second, check responsiveness, assess the person's condition. Third, cover burn if the person has burn, cover them with sturdy gauze or clean cloth. Precautions to prevent electric shocks. Avoid water. Never handle electric appliances with wet hands or near water. Second, use protective gear. Wear insulating gloves and safety goggles when working with electricity. Third, inspect equipment. Regularly check electric equipment for damage and repair or replace faulty items. Activity 4. Slip strips and falls are common and can cause various injuries. Here's how to handle and prevent them. First aid for slip strips and falls. First, assess the situation. Check the person for any visible injuries. Second, stop the bleeding. If there's bleeding, apply gentle pressure with a clean cloth or bandage. Third, treat minor injuries for sprains, bruises, or any minor injuries. Precautions to prevent slip, strips, and falls. First, keep walk clear. Remove any cluttered cords or any obstacles from floor and walkways. Second, use proper lighting. Ensure all areas, especially stairways and hallways, are well lit. Third, wear appropriate footwear. Choose shoes with good traction and support, especially on slippery surfaces. Activity 5. Choking can be scary in life-threatening situations, but knowing the right first aid and steps and taking some precaution can make a big difference. Here's some quick guides. First aid for choking. First, check the scenes. Ensure the area is safe for both you and the person choking. Second, ask for consent. If the person is conscious, get their permission to help. Third, back blows. Give 5 sharp blows between the person's shoulder blades with the heel of your hands. Precautions to prevent choking. For adults, cut food into small pieces. Chew food slowly and avoid talking or laughing while chewing, and limit alcohol consumption before doing meals. For children, keep small objects like marbles, beads, and latex balloons out of reach. Supervise meantime. Ensure children sit while eating. Avoid giving young children foods that can easily get lodged in the throat, such as hot dogs and nuts and grapes.
Activity 6. Eye injuries can be quite serious and require prompt attention. Here's guide on first aid and precautions for eye injuries. First, chemical burns. Don't rub your eyes. Keep your eyes open and flush them with water for at least 15 to 20 minutes. Seek immediate medical help. Foreign objects. Don't rub your eyes. Try to blink to see if your eye can naturally remove the object. If not, gently lift the upper eyelid and roll your eyes to try to dislodge the object. Close the eye. Apply a cold compress for 5 to 10 minutes to reduce swelling. Avoid putting pressure on the eye. If there is significant pain, vision changes, or bruising, see a doctor. Precautions to prevent eye injuries. Wear safety gear. Use safety glasses or goggles when working with tools, chemicals, or playing sports. Be cautious with chemicals. Handle household cleaners and industrial chemicals carefully. Supervise children. Keep small objects and hazardous materials out of reach of children. Activity 7. Poisoning can be a serious and urgent medical emergency. Here's a guide on first aid and precautions to help you respond effectively. First aid for poisoning. Identify the poison. Look for flaws like empty bottles, scattered pills, or unusual odors. Call for help. Immediately call emergency services or your local poison control center. Do not induce vomiting. Unless instructed by a medical professional, do not make the person vomit. Cautions to prevent poisoning. Store medicines safe. Keep all medicines in their original containers and out of reach of children. Use child-resistant packaging. Ensure that all potentially harmful substances are in child-resistant containers. Keep chemicals looked up. Store household cleaners, chemicals, and other hazardous substances in locked cabinets.